Many of us remember in school getting tested for scoliosis, doing the, bending over to see if there's any sort of rib hump. And physical therapists can help a lot with scoliosis. First, we need to determine if it's a genetic issue, because that's definitely a cause, or if it's idiopathic. Now, when it's idiopathic, they don't know what the true cause is. And unfortunately, it can be a multitude of different causes as to why you're having a scoliosis. There was even research done on rats that showed that they changed the size of their bite, and that actually rotated their first cervical vertebrae because of how their jaw was functioning, and it caused a scoliosis. So we're going to be looking up and down the system, looking to see where the main curve is, to see what could be causing it. It could be from down below, it can be up from above. It could be your viscera that's adhered. I've seen that, where there's restrictions within your abdominal cavity. And because of the importance of your digestive system, your body says the musculoskeletal system needs to kind of shift and change to take pressure off of it, so there's not a perforated bowel. And that will cause a scoliosis in the lumbar spine. If you do have a scoliosis that's more genetic, we need to make sure you have range of motion in each of those joints, that you don't have these areas of hypomobility that will lead to areas of hypermobility. So when you have a lot of hypermobility, then you might end up seeing that you need to have fusions in your future, that you need to fuse multiple segments. So we want to make sure that you keep that range of motion, you keep really healthy spine mobility, to make sure that you don't have problems further down. So even if it's more of a genetic issue, we can still help to make sure that you have good mobility and that it shouldn't lead to pain further down in your life. If it's an idiopathic reason, we might even be able to find the reason why you have that scoliosis and correct it so that your spine starts to straighten out again.